Welcome, everyone. Thank you for joining us. Before we say anything further, let me point out that we have interpretation available in Spanish and in French. In order to access the interpretation, click on the globe at the bottom of your screen and select the language that you would like to use. I'd like to invite everyone who's joined us to introduce yourselves in the chat. And if you have any technical issues, please go ahead and put those in the chat. So my name is Jenny Miller. I'm very pleased to welcome you to this event on healthy NDCs, healthy nationally determined contributions. This is hosted by the Global Climate and Health Alliance, and we have some excellent guests here as well to join us to talk about this issue. We'll have presentations from a couple of folks, then some panelists in dialogue, and then we will have ample opportunity for questions at the end. And so I'd like to invite you to, if you have questions that you'd like to ask of our panelists, to please put those in the Q&A rather than in the chat. I want to remind our speakers to speak a bit slowly because of interpretation and to please stick to time. And then without further ado, I am going to introduce Jess Beagley, the Global Climate and Health Alliance policy lead, who will lead us off and get us into the heart of the discussion here. Over to you, Jess.
Thank you ever so much, Jenny, and thank you to everyone for taking the time to join us today. It's really wonderful to see so many people on the line. So I'll speak briefly about NDCs and why they matter for health before hearing from our other wonderful speakers today. For anyone that's not already familiar with NDCs, they are national climate plans to deliver the Paris Agreement and specifically emissions reductions in line with the Paris Agreement's goal of limiting warming to 1.5 degrees Celsius above pre-industrial levels. And of course, adaptation is also vital for health and for everything else. And many countries also choose to include this information in their NDC. And increasingly, loss and damage is also being featured in addition. We are not on track to deliver the 1.5 degree goal, and indeed the World Meteorological Organization suggests that the target has already been breached. The September 2024 UNFCCC NDC synthesis reports indicate that if national climate plans for 2030 were to be fully implemented, then global temperatures would still reach 2.1 to 2.8 degrees Celsius by the year 2100. We're already seeing health systems overwhelmed at current levels of warming, and temperature rises at the upper limit of this range would simply be catastrophic for human health and would mean that the health hazards of climate change also exceed the limits of adaptation in many settings, both in the health sector and in other sectors. 5 years. The latest plans are due to be submitted this year and outlining plans until 2025. So governments have an opportunity this year to increase their ambition and to plan actions to create healthy environments that enable populations to thrive and to avoid dramatic health and wider costs of climate impacts. This may be the final opportunity to do so. And officially today is the deadline for these updated plans, but only 11 countries have submitted so far. What we really need is to see NDCs delivered by September. This is really key for assessing future projections and where this leaves us. And high-emitting countries have a duty of leadership in submitting plans that show their willingness to reduce emissions in ways that reflect their historical contribution to the climate crisis. But of course, timeliness doesn't guarantee quality, and the quality of these plans is paramount for climate and for the health of people. So we hope that the discussion today is really useful for unpacking exactly what a healthy NDC might look like. And there's been really wonderful work that's been done on this. And just to name both the World Health Organization and the United Nations Development Programme, we'll hear from Elena and Suvi later today. And thank you to them for their work on that. In terms of where we stand currently on the explicit integration of health into nationally determined contributions, the vast majority of countries already mention health in their last NDCs, but of course just mentioning health isn't enough to protect it. We need action, we need to do things to protect health. So in addition to mentioning health, NDCs have to specify actions in the health sector and other sectors that have a bearing on health, like energy, agriculture, sanitation, transport, and urban planning, because we know that these have a huge bearing on healthy air, and access to nutrition and water security and active transport and safe places to live and to work. Actions don't happen unless they're monitored, and they also don't happen unless they're financed. So it's really key that countries also include information on what the health budgets are that are required to implement some of these different actions and commit that financing. And also to track the returns on investment. And I think we'll hear a little bit later from some of our speakers on how this can be done well. A really important note to mention on finance, not least because of the global political context that we currently find ourselves in, is the fact that none of these actions will be possible, whether or not they're written in NDCs, unless we see huge increases in the levels of climate finance that are currently available. In the lead up to COP29, allies from the Global South made it extremely clear that what would be needed to deliver climate action across mitigation, adaptation, and loss and damage was in the order of 1.3 trillion US dollars per year. And so far, we've seen from COP29 that the amount committed is only 300 billion US dollars a year. So NDCs aren't developed in a vacuum, and they are going to depend on this wider political context. But without further ado, I will hand over to Fabio to tell you more about the analysis. Fabio Cresto Elena is an expert in climate impacts and adaptation and has a 9-year academic background in climate science. He's supported the development of several NDCs and also National Adaptation Plan, NAPs, and has been working on climate policy and finance at both the national and the global level. So Fabio, over to you. Thank you so much.
Thank you, Jess. And I'm gonna share my slides. So, okay. Let me know if you can see them, but yeah, perfect. Okay, perfect. So, thank you, Jess, for this introduction. As just mentioned, we analyzed with this report most of the new NDC submitted before the 4th of February. Here in this map, you can see the countries that we looked at. The ones in greens have the NDC, which are called NDC 3.0, which have emission reduction objective till 2035. We also analyzed 2 countries, Canada and Japan, in which the NDCs was not fully published, but we analyzed the overall target that it was published, and finally some of the new updated 2030 NDCs. So how did we analyze these documents? So really, we read basically the documents that were published on the UNFCCC site and some of the documents which were cited in the NDC. And we combined this desk research with interviews with experts and people who were sometimes also involved in the construction and elaboration of the NDC to be sure that we didn't miss anything. We didn't invent a new methodology, but we built this report upon the methodology which was developed by GCHA for the Healthy NDC scorecards, and also on the COP29 recommendations for from the international health and climate community. We considered these categories. I'm not going to read through them, but the idea is that we didn't only consider if health was mentioned in the NDC. We also looked at really the ambition in the emission reductions. We looked at how planning and governance was structured within the NDC. We looked at the potential participation of marginalized and vulnerable groups. And we looked at climate actions which were targeting the health sector per se, if any, or co-benefits for the health sector within other sectors like agriculture, water sector, transport, and so on and so forth. But we're going to go through some of these results in the next slides. So if you want to know more about each one of the countries that we analyzed, I really invite you to read the report. We try to go with a view from above and trying to see basically general trends that we found while analyzing these NDCs. In general, the first news is not great. So for most countries, emissions reduction targets are not yet aligned with the Paris Agreement and therefore sufficient to protect human health. On the other hand, though, we could see in general an improvement in respect to previous NDC in the governance framework that has been developed. So many countries linked their climate plans with other plans, which were economic strategies or development plans or sustainable development plans or legislation. And some NDCs even highlighted the importance of local governments for the NDC and the climate action implementation. For example, the US NDC. So even though this policy coherence seems to be improved, though, within the health sector, there is still a lot to do, in the sense that if the NDC, many countries were aligned to some policy or national strategies, this doesn't always mean that they were aligned to public health policies. There is still a lot of room for improvement in this sense, linking really the national health strategies with the national climate plans. In general, climate actions across different sectors, though, were increasingly tied to health outcomes. Nevertheless, again, here there is room for improvement in the sense that these alignments were more with words rather than with precise indicators to monitor. So 4 countries among the ones that we analyzed have begun incorporating really health impacts and adaptation strategies into their climate plans with a specific health sector, recognizing also critical links between climate actions and health outcomes. Most of these countries basically have specific health actions that are targeting the health sector, including, for example, actions to reduce the incidence of vector-borne diseases, for example, the Panama NDC, or air pollution. And I'm thinking, for example, at the UK NDC, which has a really developed strategy on how to reduce air pollution from the national to the local governments. In many other cases, though, these actions were limited to the fact that, okay, we need to study more about understanding what are the impacts of climate change on our health system. So we are still a bit behind within the health sector in respect to other sectors like, for example, forestry or agriculture, which have a much longer history of a nexus with the climate impacts that the health sector still doesn't have or is still building in this sense. Almost all documents, though, emphasized the importance of considering the health co-benefits of climate action, for example, improve air quality and enhance public health through sustainable urban planning and transportation. But even here, as I mentioned before, few of the documents we analyzed have specific indicators that can tell us how much of a co-benefit are we talking about, or how to track these co-benefits if we should invest in climate action. We also looked at potential financial commitments that countries made within their documents. In general, most of the documents didn't have any financial planning connected or any dedicated funding for specific climate actions. But we also had a few exceptions in which some countries, and we're going to see about that afterwards, really dedicated a part of the document in costing their NDC or dedicating really a financial plan for climate and health actions. We also try to understand how the NDC was made. So if marginalized and more vulnerable groups were involved in the construction, in the elaboration of the NDC. Most of the NDCs basically highlighted that this was a result of a participatory process, but there is still a lack of transparency of how the feedback of these groups that were consulted actually went into the final document. So improvement in this sense is still needed. And finally, we also looked at the potential monitoring system for how climate action and climate and health action can be tracked, monitored, and reported. Most of the NDCs have a mention at least of a monitoring system, but none of them, except really few of them, have a health-specific monitoring system. Health, I mean climate and health. Nevertheless, if a country already has a monitoring system, it would be possible in the future, if health outcomes have to be tracked, to be included in this national monitoring system. So we try to put all what I said in this graph here. And as you can see, we try to spread the countries on 2 dimensions. So on the y-axis, you can see the ambition of the emission reduction target. So countries at the lower end of the graph, in the lower part, have a relatively lower ambition, whereas countries in the upper part have a higher ambition in the emission reduction target. We also try to put the countries or classify the countries within their ambition of the climate and health actions that they describe in their documents. So countries on the left-hand side have really or relatively small ambition in the climate and health actions, whereas countries on the right-hand side have a higher display, at least in the document, a higher ambition. And we also have different colors that you can see, as countries in red don't talk about in their document about financial framework or a monitoring framework for the climate action that they describe. Countries in yellow have either one or the others, and countries in green have both. In the document of these countries include both a health monitoring framework and a specific financial commitment for health and climate action. The countries in gray that you can see are countries that we didn't, in which we couldn't read the whole document. So we just analyzed the emission target ambition, which wasn't great, but still we put it here. So it doesn't mean that they will not end up maybe further right in the graph once we can analyze the whole document. And finally, we also developed at the end of our report some recommendations for what we call Healthy NDCs 3.0. We call in this report for an increase in ambition. And with ambition, we mean that all countries should aim for more ambitious emission reduction targets with explicit integration, ideally, of health benefits. I'm not going to go through all of these recommendations. You can read them in the report. But what I wanted to say is that we know that it's not as simple as we wrote down here to integrate health actions and climate plans. This takes a lot of coordination among different ministries: Ministry of Environment, Ministry of Health, Ministry of Finance, and others. So one thing that I would say it's really important would be seeing this process of NDC as an opportunity also for the country to establish, ideally, cross-sectoral governance mechanisms that can also go beyond the simple or the elaboration of this document, but can ideally integrate health and the health planning, health and the dialogue between health ministries and other agencies through planning and implementation of sustainable and just climate action, which in the end will result in healthier population and healthier ecosystems within their nation. I'm leaving it here. I thank you so much for your attention. I'm really happy to discuss about our findings now or later, and I pass it back to Jess. Thank you.
Thank you so much, Fabio. We are going to move to a panel now with representatives from UNDP and from WHO. If Elena and Suvi, I can welcome you now. Thank you so much. I'm just going to spotlight both of you. Apologies for not being faster. So Elena is capacity building. Elena Villalobos-Prats is capacity building and country support lead with the World Health Organization, and she is the secretariat lead for the Alliance for Transformative Action on Climate and Health, ATACH. And Suvi Hukuri is policy specialist with the United Nations Development Programme's HIV and Health Group, working towards better governance for climate and environment-related health outcomes. Before joining UNDP, she worked both with WHO and with the government of Finland. So thank you so much, Suvi and Elena, for joining us. To kick off with a few questions to each of you before we move to the wider discussion, and I'd encourage people to continue posting questions in the Q&A box, if you may, rather than in the chat. But Suvi, could you please share a little about how UNDP supports governments in developing NDCs and in embedding health? Thank you.
Thank you, Jess, so much. And good morning from New York. It's great to be here and to be able to speak about this topic and very interesting research results also from the analysis. Thanks for sharing. Let me start by mentioning that last year, the UN SG, Antonio Guterres, asked UNDP to lead the UN system's joint effort in providing NDC support. And this is done through our flagship initiative called the Climate Promise. It was established 6 years ago and is now the largest climate portfolio in the UN, with over 2 billion in grant financing and over 140 countries supported so far. Its original goal is to help countries to access climate finance and develop ambitious NDCs across sectors such as energy, land use, forest, nature, and others. And while we supported more than 80% of developing countries to put forward more ambitious pledges in the past, it is clear to us that more comprehensive approach is needed as climate change accelerates, and we experience crisis and conflict, accelerating biodiversity loss and pollution, political polarization, and also bigger health impacts from climate change. And our renewed support, called the Climate Promise 2025, helps countries to align NDCs with sustainable development, human rights, gender equality, and other goals that are key to reaching the SDGs and the pledge of leaving nobody behind. Our Climate Promise 2025 currently supports 80 countries. We started with stock taking of the past NDC implementation, after which we offer targeted in-country support on NDC revision and implementation, in collaboration with partners, including the NDC partnership. The country-level efforts are led by the resident coordinators, and at the global level, we provide technical assistance, coordination, and advocacy, such as developing joint UN messaging. Health became part of this work of Climate Promise framework last year. Through this support, we are able to help countries to strengthen their NDCs in areas such as screening the health sector, building climate resilient and low emission health facilities, sustainable procurement, solarization of health centers, healthcare waste management, and digitalization of health infrastructure. And many of these things are done in collaboration with WHO and other key partners. And one of our main areas of technical support this year is also around air pollution that was discussed. We have expertise through developing investment cases on air pollution and also legal environment assessments. We've done this in more than 5 countries so far, and more are coming. Funded by the Clean Air Fund, we have a new initiative that aims to integrate air quality and superpollutants into NDCs. These pollutants include black carbon and ground level ozone, for example. And they are very much responsible for lung diseases and deaths when inhaled. So that's an important new area that we are working on. So yeah, these are some of the examples that we are providing in the area of health. Thank you.
Thank you so much for sharing that, Suvi, but also for doing the work in addition to sharing the work. Really grateful to you. To move now to Elena, WHO has conducted several analyses and produced guidance for embedding health in NDCs. Can you tell us how this is going to feature in WHO's work in the coming year?
Thank you very much, Jess. Allow me first to thank the Global Climate and Health Alliance for inviting WHO to be here, but more importantly, for all the work that you've been doing to promote the integration of health and the scorecard. I think that's amazing, and we really appreciate it from WHO. I think WHO started to focus on the NDCs probably in 2016. We have a full package of support to countries that basically is implemented through our regional and country offices, and which looks to 3 key areas of work. The first one is to understand and support countries to understand and address the health impacts from climate change. The second one looks at health systems. So we aim to support countries to strengthen the resilience of health systems while decreasing their own contribution to climate change and overall environmental degradation. And the third one basically is working with ministries of health and health sector at country level for them to be able to work with other sectors to promote those mitigation and adaptation options that are going to be accompanied by most of the health positive health impacts. Is what we call co-benefits that also Fabio referred to. When working with countries, basically there are different ways for us to promote everything we do. And you rightly mentioned, we launched last year a specific quality criteria, basically looking at everything that has happened until now for countries to integrate health within their NDCs. Just let me acknowledge that this was led by my colleague Amy Savage, who couldn't be here with us for different reasons today, but she's been really leading technically the overall country support on NDCs. And basically, based on the support that we gave until that year, we analyzed good examples and things that should be promoted and basically develop these quality criteria, which now is integrated into the full support that we will provide to countries. We do that through implementing projects. So all of the projects that we're implementing probably over 25 now, basically we integrate this integration of health within those projects in countries. We also can do this basically when we receive a specific request from technical support from either countries or technical partners. For example, FCDO is implementing a project in Nigeria, and they will support the Ministry of Health to integrate health within this NDC. And basically, we support them to ensure that this is of enough quality. We are very excited also with the Climate Promise and to be part of this UN effort. As a technical agency, we are making sure that we provide the technical support that countries are requiring. We see that this is increasing, and we see this is increasing just because in the last assessment that we did, we realized that health has increased in terms of representation. 91% of all of the countries now integrate health as a priority. Is less, for example, when we look at quantification of health co-benefits, is only 10%. So just to mention also that we work very closely with our colleagues working in the air pollution team, with colleagues working in nutrition and food safety. And basically, we are seeing that this will be one of the priorities for this year. Thank you.
Thank you, Elena. I'm really looking forward to seeing what's coming down the line. Back to Suvi, what kinds of challenges have you observed in integrating health into NDCs? It's great to talk about as an idea, but how do things really play out, and how can some of these challenges be overcome?
Thank you for that question. I mean, we have some insights on this through interviewing a set of UNDP country offices 2 years back when they were developing the past NDCs, the ones that are now being enhanced. We were asking about partnerships and success factors and challenges that they faced in that process back then. And many of these solutions were also mentioned by Fabio in his presentation earlier, but let me restate what we also heard from our country offices. Well, we learned that unavailability of climate and health data is still a challenge for many countries, which makes it hard to include measurable activities. And also, we understand now that many health impacts of climate change are still not fully understood. For example, the impacts of extreme heat to human bodies. What does it actually mean for people who have pre-existing conditions or are pregnant or lactating or similar? So this is something we still need to understand, which makes sometimes hard to create activities around these questions. And many countries don't have good air quality data still that could be matched with health impacts, and also absence of economic data on health impacts and the climate impacts is often missing, which makes it really hard to develop budgets that makes most sense for the countries. So some solutions that we have here is, of course, to go for the Ministry of Health for data requests. But if these don't exist, then to speak with national statistical institutions, the World Meteorological Organization, WHO, of course, and similar agencies that make data publicly available on this. And of course, collecting new data is always possible. There's WHO's benefits of reducing household air pollution tool, of course, that a lot of people are using, including UNDP in their support. And there's options like satellite data. You can, if there's no air pollution data, you can gather it somehow, some other ways through proxies and others. Another challenge that we've learned is that health sector was not always involved in the NDC development in the past. And that led to absence of health or weak health components. And there are many reasons for this, such as the health ministry was not invited, or some cases they were invited, but no one was appointed due to lack of expertise on climate and health, or staff shortages or similar. So these are very reasons that we all understand, but actually they make a big difference in the process if there's absolutely nobody who would contribute. But also the MOH is not the only one who can play a role here. Of course, WHO, UNICEF, World Bank, civil society, and others can bring up health components and needs. And we truly hope that with the resident coordination-led system, all sectors are now more involved in the NDC development. Then, which was also mentioned by earlier presenters, that there's not always vulnerable populations engagement. And this would be really important to uncover health impacts for climate change across country and groups, including from those that live in remote areas. So without this participatory approach, it's hard to reach the ones that are maybe experiencing the hardest climate impacts or are otherwise left behind, such as the poor, children, disabled women, and indigenous peoples. UNDP actually provides targeted support to this inclusion. Right now, we have a tick box system of all NDCs that we are supporting on to make sure, at least to help countries to make sure that these groups are included. And we spoke about the lack of funding. So I don't know if I need to go more to that, but we know that there's lack of funding. There's huge gaps there. Many countries face hardship of implementing their health activities in the NDCs. And there are strategies such as using domestic budgets, taxation of fossil fuels, donor arrangement, private sector engagement, and more that can be used. And there's specific guidance available from, for instance, from NDC Partnership and UNDP and others. And lastly, sometimes countries might think that in order to include health in the NDCs, they need to build new activities from the ground up. But what we learned that many countries that actually included health integrated existing activities or action plans in the NDCs that had health components. And this will also boost their chances of getting implemented if not done yet. Or we can add health indicators to programs that have health co-benefits as discussed. For example, adding reduction of non-communicable disease indicators or health sector's readiness to treat air pollution conditions. They can be added to air pollution programs as one example. So I hope these were helpful. I know these were discussed earlier, but I think we all come across the same challenges more or less here, and it's good to see that we can figure out solutions and discuss hopefully here today also on some of them more in detail. Thank you.
Thank you, Suvi, and absolutely really keen to keep exchanging both with the two of you and also with this wider group about what is working and where we still need to find solutions in working towards what we're all hoping for. A final question then to Elena before we move into the audience participation Q&A. Elena, can you tell us which tools already exist for really making the health benefits of climate action clear in NDCs? We know this can be a really important way to increase the prioritization of these actions and to show why they're valuable economically and for human lives. And can you tell us where you've seen these tools already being used well? Thank you so much.
Thank you, yes. And basically, I know that we are short in time. I will try to be fast. I think the key tools that are available can be basically linked to WHO's support on climate change and health. So we've developed a lot of tools for adaptation and resilient health systems. And we can see that those have been used very widely because basically these reflect the projects that we've been supporting countries to implement over many years. This country support package was started to be developed 16 years ago. So basically we can see that this is widely really adopted. And so, for example, we have the operational framework for building climate resilient health systems, which is used by countries to develop their health components of national adaptation plans. And we see that usually they integrate those priorities that they develop for adaptation and resilience into the NDCs. So there is a chapter specific looking at adaptation, and this is quite well covered. Then under mitigation, the chapter, there are several tools developed by colleagues in the air pollution and urban health team. So ones are looking at transport, both cycling and walking, but also road. Then we have tools for outdoor air pollution, tools for indoor air pollution, and then also tools for green spaces. So those are looking specifically to specific sectors, and we also have tools for health impact assessments more broadly. So for example, looking at health gains in changing different policies in specific sectors. So we also have a costing tool that can be used for finance on climate change and health. And we also have an economic framework for climate change and health, which is also being used by some countries. This being said, I think that depending on the ambition that countries have, they can basically decide which is the best for them to focus on. In some cases, they will prioritize, in any case, adaptation and resilience, because some countries perceive that this is the most important thing that they can do. We also have scaled up a lot the support that we provide countries to reduce their emissions in health systems. So probably we will see an increase in the integration in the NDCs now. And let me just also acknowledge the support that we are receiving from Welcome Trust and Spain to support countries to integrate health within the NDCs, because they really want to strengthen also this overall UN coordination mechanism and ensure that WHO responds to the request received from countries for the integration basically of health. So something that is very important that Fabio referred to, and I was very happy that this is also promoted by the Global Climate and Health Alliance, is that when we support countries to do anything on climate change and health, basically it's very important for us to promote these multi-stakeholder coordination mechanisms. So basically, in many countries, those already exist, and the idea is to give responsibility to all of the health determining sectors to promote health and protect health. So it's not only the responsibility of ministries of health, and with this NDC work, this will have to also happen. So basically, these country coordination mechanisms are responsible for everything, for planning, for implementing projects, for coordinating finance of relevant partners at country level around priorities by ministries of health. And this will also have to take this responsibility for NDCs. For the attached last point, sorry, forgot to even mention, WHO is also the secretary of this Alliance for Transformative Action on Climate and Health, basically, where 93 countries have committed to do more on climate change and health. Under this attach, we are also promoting the integration of health within NDCs. We will be organizing a technical meeting on this topic, and we will keep you posted. Thank you very much.
Wonderful, thank you, Elena. And now that we have all four of us and we have some many questions in the chat, I'll pass over to Jenny to moderate the discussion. Thanks, Jenny.
Thank you, Jess, and thank you to all of our speakers. You're generating a lot of interest and a lot of questions. I'll actually mention two questions at once. One is a very simple question, but it's come in a couple of times. I know, Fabio, you answered it for one person. Why are only these countries analyzed in this report? And let me go ahead and ask the next question as well. That's a meatier, more substantial question. What are the differences between different countries and the priorities that they should emphasize? So we have high-income countries, low-income countries, particularly vulnerable countries, and what should they be prioritizing in their NDC? And one person even asked, as we live in vulnerable countries with existing commitments, but face unstable political situations, what roles can we play? So really, there's a wide range of different circumstances that different countries find themselves in, and how should different countries be engaging with their NDCs? But maybe if we could first respond to why are there just these countries in this particular report, and assuage that question for people.
Okay, this is an easy question in the sense that we analyzed the NDCs that were published between June 2024 and the 4th of February 2025. I remember somebody asked about Spain or their country. If they are not there, it's because they haven't been published their NDC yet. Today, as we mentioned at the beginning of the webinar, it was the official first deadline to submit their NDC. Most countries haven't yet, but we are going to see a lot of other documents coming up online throughout the year. So I invite you also to monitor the UNFCCC site with the NDC registry to see different countries and their commitment. Spain in particular is going to send their NDC with the EU. So.
And perhaps I can come in on what we imagine different countries, different governments might wish to prioritize when they're developing their NDCs. We know that there is so much to consider for health, and it's not always easy to think through where to start. But for high-income countries, or particularly high-emitting countries, really the best thing that can be done for health in the NDCs of these countries is to mitigate fastest and to provide finance to developing countries to enable that health promoting finance action, while domestically making sure that emissions are in line with what is going to be needed to make sure that we do deliver the Paris Agreement and that we avoid levels of warming that are going to be really dangerous for human health. For nations that are already facing very severely or most severely the health hazards of climate change, of course, adaptation and loss and damage are really high priority to include in NDCs. And while we know that climate finance is incredibly falling short of what is needed, it is really valuable to put into NDCs what the price tags are for the different actions that need to be taken, both in the healthcare sector and also in health determining sectors for adaptation, like agriculture and sanitation. For any country, it's, I guess, really important to look at what the health burden of climate change is in the country. So we'd really recommend carrying out a vulnerability and adaptation assessment to think through where to start. I'm sure other panelists have thoughts on that too.
If I may complement that, I fully agree
please,
with Jess. And I think from our experience, sometimes countries get a little bit obsessed in doing something that is very technical and very data intensive modeling. So for countries that are not yet to this level, that they don't have the capacity, I think you can do a lot, basically just looking at adaptations, on qualitative assessments, also looking at mitigation, look at data that is available, make some assumptions. And then, of course, the most important probably is to integrate health also in the finance and implementation and monitoring sections. So you can do a lot already by integrating your health priorities in your health component of national adaptation plan, your national adaptation plan, your national communications, your national strategies on climate change and health overall, any work that you've done at country level, assessing emissions from health systems level, and basically just trying to make sure that this is reflected then in everything that needs to happen with the implementation of the NDC. If you can have some also discussions with other sectors, in many countries, the collaboration with the water sector is already there, with the energy generation, with the transport, urban planning, and then make sure that at least health co-benefits are included there, even if it is mentioned, that is already good.
I don't think I have much to complement here. There was a lot of points raised, but maybe from UNDP's perspective, as we support developing countries only, links with poverty and inequalities in health are something that we hope that a lot of countries will bring up to in their NDCs through health components, but also addressing the death toll from air pollution, which is more than 8 million according to newest estimates, is something that a lot of developing countries could bring in the NDCs to make a meaningful change in the health of their populations.
Thank you. Okay, we have a number of questions that are asking different versions on the question of what are there lessons learned from NDCs that have been done well, from countries that have done well in integrating health into their NDC, and if so, what worked well and why were those done well? A more specific question about, is there an example of an NDC whose health components have been implemented and monitored transparently? And then a question from Daniela Chiaretti from Valor Econômico in Brazil. And Daniela asks, GCHA suggests that Brazil's NDC requires a more structured and ambitious framework to achieve meaningful health and climate outcomes. Could you give some examples on that? So, what are some examples of NDCs that are doing this well, NDCs that have then, the country has then monitored the commitments, and specifically with the example of Brazil, what would a more structured framework look like? Do we have examples of that, or do we have recommendations for that?
For sure. Thank you for the question. I mean, I hope I don't forget anything, but starting from the beginning, the positive examples are, for example, I'm thinking about the UK or Panama, that basically within their approach, they try to first involve a lot of sectors. If you look at the NDC of Panama, for example, you have really transparently the list of everyone who participated. It doesn't need to be like this. Also, Panama is a relatively smaller country in comparison to others. But also from the NDC of the UK, you really could see which local government participated to their health and climate related action to build them together. And this basically ensures afterwards the buy-in, the early buy-in of stakeholders, which then will have to implement the actions that the NDC is highlighting. If there is a central government that tells, okay, we plan to do this without really involving the organizations, the people, the communities that then will have to implement this action, it will be much more difficult to really make this action happen and to make it sustainable, to convince the people that this action is actually needed after that it's afterwards, after it has been planned. And regarding Brazil, I hope I didn't forget anything, but regarding Brazil, the idea is that within the NDC of Brazil, there are a lot of there's a really well-structured governance framework regarding, for example, deforestation. And but there is nothing or really few things which parallel this to the health sector. There is something which is, for example, which is called health co-benefit of regarding air pollution, which I assume it regards like it connects to transport or reducing forest fires, but there is nothing explicitly. And it is also mentioned that during this year, going to COP30, Brazil is going to involve the civil society, academics, various stakeholders, even the private sector and the local governments, to build their own national climate plans, which involve also the health sector. So we suggest that at least within this framework, well, health should play a more central role than it does within the framework that the NDC of Brazil highlighted.
Would anyone else like to come in on that before we go to another question?
Maybe just to flag a point on monitoring. So often NDCs contain commitments to monitor the health outcomes of the actions that are in the NDC, but a really key resource to look at is, and I'm sorry for another piece of UNFCCC jargon, but biennial transparency reports, which have to report on the implementation of nationally determined contributions. There was a deadline for those at the very end of December, and there are now a number of these reports available online. We haven't analysed them in detail yet, but I will put the link to those reports in the chat so that people can see how healthy implementation of NDCs is actually being tracked and reported on.
Great, thanks. Okay, moving on to a next set of questions. We have a number of questions that relate to how folks can support their countries to develop more ambitious NDCs. We have a question about for countries that haven't yet submitted their NDCs, are there advocacy steps or approaches that you'd advise for civil society health advocates to engage in? Are there how can international partnerships and collaborations help embed health in the NDCs? Can research institutions, what can they do to help better integration of health into NDCs? So a number of different, from advocacy to international collaborations to academic institutions, what can folks be doing to strengthen the integration of health in the NDCs and the outcomes that we want to see from that? And actually, I might add in one more and maybe start by directing this one to Elena. Somebody also mentioned, what is the role of the private sector in this? And I know that the Attach program works with private sector to some degree. So what is the role of private sector in integrating health into the NDCs and achieving these outcomes? So anybody that would anyone like to come in on one of those?
Well, I can try to say a few points to the first question. I leave civil society point for for colleagues here, but if we think of international collaborations, how they can contribute to NDCs, I think connecting with UN agencies in the country level can be one way. So now, as I mentioned, the resident coordinators are putting together. The idea is to all sectors and all UN agencies that are relevant to this process. So basically connecting with them is one approach. And what comes to research institutions, definitely data is still something that is missing in many countries. So having that kind of same kind of collaboration with them through the ministries of health or other ministries, for example, is a really good way to participate. And of course, knowing that the NDC process is led by the government, so they then decide, of course, who will be part of it and at what stage. But there are multiple venues that one can try to influence and be part of the process, I think.
So maybe I will just jump into to build on that and respond to the second question. I wanted to mention that WHO has a communicating on climate change and health toolkit for health professionals, which is very nice and can be used for advocacy purposes at any level. I think also in terms of engagement, for sure, the one leading at national level is the Ministry of Environment or Climate Change or the Vice President Office. So it's going to be very important that whoever is interested in contributing to this process basically finds the mechanism to get in contact with somebody who is following the formal process. So ideally, there is some space for other constituencies to contribute, including youth and private sector or research institutions, academia. For sure, when countries want to do something that goes into quantification and even health co-benefits, you will need a lot of analytical strength. So somebody really doing a little bit of this assessment, which is not very easy. And it would be great if capacity at country level can be built. So that's how WHO does things. Basically, when we work with a country, it's not that we go and do the assessment and then leave, really accompany the country to do that themselves. So I think that involving research institutions, academia into this exercise is key, but they need to get involved into either in collaboration with ministries of climate change or with the health sector or the specific sector that is going to do something. With regards to the private sector, there are mechanisms for the private sector to engage in this Alliance for Transformative Action on Climate and Health, because, of course, they are doing a lot also on climate change and health, including in decarbonizing health systems. I don't know, and probably UNDP is best placed on that because WHO at country level, basically, we are the ones talking to ministries of health, not that much to private sector, I would say, at country level. So I don't know, and UNDP are best placed to work with other sectors and then just make sure that this connection with health is made. So I don't know, maybe I will bring the ball to you, Subi. What's your experience in involving the private sector into NDCs?
I mean, we work, for example, in the energy sector, we work with the ministries of energy through multiple initiatives. Also in the health sector, for example, Solar for Health initiative, which is providing solar panels to remote health facilities and storage facilities in the lowest income countries. And in that effort, we try to work with the private sector to kickstart the work the first few years, and then sort of shift the funding and the operations to the ministries of health. So that's sort of like a sliding mechanism how we integrate help from the private sector and their knowledge and technical assistance, and then create country ownership later on. So that is one example how we do it. But we do have private sector strategy and other examples, I'm happy to share maybe through Jess if there's a lot of interest on that. So I can send some publications over afterwards.
Great. Thank you so much. Well, there continue to be questions coming in, but I'm afraid we're out of time to take more questions. I want to give a tremendous thank you to our speakers for taking the time to join us and to talk about this important issue, particularly in light of everything that's going on right now and the huge demands on everyone in the health space at the moment. And similarly, I want to really thank all of you who joined us today, again, for taking the time, for being interested in this issue, for your interest and commitment to working on the intersection of climate and health and protecting the health of people around the world in the era of the climate crisis. GCHA will be continuing to do work on the nationally determined contributions throughout the year. As our speakers noted, the NDCs that were analyzed in this report are just the first few that have come in this round. And the vast majority, I believe 170 countries, are expected to still submit their NDCs over the course of this coming year. So there are opportunities to help countries, support countries to really integrate health and take full advantage of the health benefits of climate action, and just to think holistically and deliver those maximum benefits across climate and health and economies. And also to be thinking about how this looks different in different countries, what kind of support certain countries will need to be able to implement, and so on. So GCHA will continue to do work on this throughout the year. We invite all of you to work with us, to join us. If you have an interest in continuing to work on this, we will be organizing events and opportunities to engage. And then, I don't know who joined us. We had a wide variety of folks who registered for this event, but if there are folks from government on the call, we invite you to and encourage you to consult with health civil society, with your fellow ministries. We really deeply, profoundly believe that this will produce the best commitments and the best outcomes across the board. So again, thank you to all of you for joining us. Thank you to our speakers, and wishing you all a good rest of your day, your evening, and a rest of your week.